Usually we see the pretty typical picky eater or kids that just are deleting foods completely out of their diet, deleting a lot of different texture types of foods, and so usually the first things to go are those lean proteins that we need, like meat and raw fruits and vegetables. We really want to find the root issue of why we're not eating. And if part of it is just the anxiety, and that comes from parents and kids both. And so we want to make sure that we're supporting the family so that they're not anxious about food anymore, and the child too, because any anxiety responses too, they diminish your feeling for being hungry. Kids really might not be ever hungry because they're so anxious around different kinds of foods. We try to work from the bottom up and kind of expose them gently to new foods with no pressure, and so they can learn to enjoy food again instead of being anxious about it. So parents, especially with our little ones, they're sitting in on our sessions so that they can see how we interact with the kids with food. A lot of it's food play, so it's really fun. And to try to take the pressure off at home too, we want all of this to translate to home and all of their other environments that they're eating in. And then when we do groups, a lot of times we have parents that are sitting behind a one-way window so that we can see what the kids are doing, explain some of their reactions that we're seeing, and why the therapist did what they did to kind of bring them back to have a positive experience with those foods. At IPT, we use the SOS approach, which stands for sequential oral sensory. So what we do is we have a food hierarchy each time that we meet with our kids that are doing our feeding program. So our first food is always going to be a food that they're comfortable with. Try to get them started off with something that they can play with and engage with right away without being nervous about it. Then we move on to new foods, and they change every week so that we can kind of see which foods that they're avoiding, which ones they're getting more comfortable with. And we make sure that we also have a variety of foods. So we always have something that's hard and crunchy. We always have something that's chewy to really work on those oral motor muscles. And we always have a puree, so something that's wet and kind of messy so that we can work on some of those harder tactile foods. We also try to mix our foods too, because a lot of times our kids have trouble with mixed textures. So while we're playing with our foods, a lot of times we'll put different ones together, like peanut butter, we'll mix it with celery or something like that, so that we have two foods, and one of them might be a comfort food and one of them might not, and just to see how we can tolerate a food that we like with something else on it.